Welcome to Meaningful Mondays with the Community Foundation of Middlesex County, where we only know good people who do great things in our community. Whether you are a volunteer, a donor, or a nonprofit organization, each episode of Meaningful Mondays will celebrate you, our friends and neighbors who have a deep passion for and commitment to improving the quality of life for all in Middlesex County. So let's kick off the week with great conversations with remarkable people, businesses, and nonprofits making a difference right in our own backyard. Well, welcome to Meaningful Mondays, everyone. The Community Foundation of Middlesex County is so honored and pleased to not only work here, but also to know the good people who do great things in our community. And we're kicking off a series this year of leaders in our community that really understand that giving back is a wonderful way to think about 1 + 1 = 3. So I'm honored to have Vin Capece, the CEO of Middlesex Health, and with us today. And I have to say, Vin, having been a patient of Middlesex Health on a few occasions, it's your turn to brag because we are so lucky to have this gem in our community. So let's start off with just a little bit of background about you, and then maybe some of the things that you think people wouldn't know about Middlesex Health. I know I've learned a lot because we've had some other of your folks on podcasts, and it was like, oh my goodness, I didn't know that.
Sure. Well, a little bit about myself. I never thought I'd work for a hospital, much less be the CEO of a hospital.
Oh, really?
Yeah, and if you go way back to when I was in college, I went to school at the University of Connecticut. I was majoring in accounting and thought I'd get a job with a big accounting firm and live happily ever after. And I did get a job with a big accounting firm, and my first client was a hospital.
Oh my
And
gosh.
I can remember looking at my list of clients and seeing that and being petrified because I wanted nothing to do with hospitals. Really didn't know anything about hospitals, but I knew it wasn't a place I wanted to go. Uh,
Right.
and it turned out to be one of my best clients. And a number of years down the road, they offered me a job, and that's how I kind of got into healthcare. I can remember when I was at UConn, the president of the university had this thing, and they probably still do this, but he would go out and talk to students and talk about things that you would expect, talk about life, talk about
Right.
academics. But I remember specifically one of the things he said, because I remember what I was thinking when he said it. He said, learn as much as you can about as many different things as you can, because
Right.
many of you think you know what you're going to do in life, but I can guarantee you that some of you will do something totally different than you ever expected. And I could have been a poster child for that. And I can remember
We'll
what I
make a
was
new
thinking,
poster for you.
but I can remember what I was thinking when he said that. I said, "This guy's full of BS. I know what I'm going to do, and I know where I'm going." And
Right.
my
Here
life
you are.
took a
It's
big turn.
interesting because I went to UConn, so we bleed blue here. I loved UConn, and I started out in education. And then, and then there are careers that don't exist right now where our young folks will be doing things they never even dreamed of. So good for you. You're an inspiration for career changes really
Well, and
make.
a lot of younger people often ask me, what's the secret to success? What's the recipe? And
Right,
there is no secret formula. But
right.
I think everyone needs to be kind of open to opportunities that present themselves, and they will present themselves, and you just have to be open to them.
Yeah, I agree. I think that's the best advice, be open to all of those wonderful things. And I know you will do that with your children. So, um, you know, I do think Middlesex Health is a hidden gem, and I'm proud to be a corporator, and I brag about Middlesex Health all the time. I learned so much no, really, we are so fortunate, and I learned so much at the corporator meetings. But we're a small group. The rest of the community needs to know about the wonderful things that you do. And I'll mention a couple. I never knew that you were using AI way before AI became a thing. So it seems to me that you keep ahead on technology and innovation. And then share your thoughts, if you will, about your team, because to be recognized by this for the sixth time as a magnet, do I have that right?
Yes.
Um, that to me is something we all should give you like 10 gold stars going
Right.
back to my
Right.
education.
Well, one of the challenges is educating people as to what that even means, because
Right,
it is something that's very rare. And I think Middlesex, one of our challenges, and it will always be a challenge because we kind of live in the shadows of two of the largest health systems
right,
in the state. And when we've done perception studies of how people perceive our organization, one of the things that stands out loud and clear is people see Middlesex as being a warm and compassionate and caring organization. And I think that's very true. I mean, I see it every day. It's very much part of our culture. It's kind of the cornerstone of who we are, and it's what differentiates us. But some people don't recognize or don't appreciate, and either because they don't know or because they might know, but maybe they don't believe it, is that we have significant capabilities. And while we don't have the span of services that maybe a tertiary care organization might have, we provide probably 95%. That's just a subjective
right.
estimate of the services that most people need. And the things that we do very well, just as good, if not better, than most of the other organizations that we compete with on a daily basis. And that's the message that we try to get out to the community. And some people believe us, some people don't. But what's interesting is when someone has an experience with us, and very often their first experience with our organization will be through the emergency room. And a lot of times people will end up in our emergency room, end up being admitted to the hospital and having never had an experience with us.
Right.
And once they do, that's when they realize, how special and different our organization is.
And as you're talking, I'm thinking we almost take you, Middlesex Health, and your team for granted until we can't take you for granted. Until my first experience was in the emergency room. We shared that before we started our conversation here, and I'm very impressed with the team. But let's go back to it's the people
Mm.
and it's your culture. And one of the things that I really found so interesting is that you're dedicated to your team, but also continuing education of your team and excellence in that. There are a couple of things that you do that I bet no one knows about. You have, and I will get it wrong, Vin. So talk about your training programs. Don't you have a residency training program?
We have a residency program for family medicine physicians.
Right,
So it's a teaching program. When physicians graduate from medical school, they have to decide what specialty they want to go into. Primary care is one of those specialties. And then you have to do a residency in that specialty. And that's what we offer as a residency. It's a 4-year residency. Most primary care residencies are 3 years. Ours was one of the first, among the first in the country that went to 4 years, because in our interaction with physicians who were graduating from our residency, they all felt they needed more education. And a lot of them use that extra year to do something special. A lot of them focus on integrative medicine and alternative medicine and use that extra year to learn about that. But it's one of our residency program is one of the top, our family medicine residency program is one of the top residencies in the country. And a lot of people don't even know we have that.
that's
But
the thing.
what amazes me and what really struck me, I mean, I've been for almost 30 years now, it's hard to believe. But when I came to Middlesex, I had worked in public accounting. I saw a lot of different hospitals. I saw a lot of different businesses. I went to work for a different hospital, another hospital, larger hospital, when I first got into healthcare. And it was a nice place to work. There were a lot of good people there. But when I came to Middlesex, I really, honestly, noticed there was a difference in the people. They really care. And I don't know what the secret sauce is. I don't know what the DNA is of our organization. And it's been there long before I came, and hopefully will be long before I leave or long after I leave. But there is definitely something special. And I talk about that because I present to our new employees at new employee orientation. And I talk about my experience when I came here and the fact that um, that's what really differentiates us, I think. And Middlesex is not a building. It's not a piece of equipment, even though, you know, all of the technology and all of the things that go along with that facilities are important. It's the people that make it all happen. And if we don't have good people, we don't have anything. And
You don't
so,
have good people, you don't do great things. Let me
right.
let me
Yeah,
insert our thing.
absolutely. Absolutely. That's a
No,
good
but
tagline.
that's it. But
And we spend a lot of time focusing on building a culture that will attract and retain the best and brightest people because that's what makes us, you know, as good as we are.
and part of your culture is giving back to the community. And that's what I'm asking all of the CEOs that we're interviewing over that we have and we're going to is we are so lucky in Middlesex County. And as a community foundation, it's really important for us to leverage partnerships because that's the only way we're really going to solve some problems that are persistent in our county. Um, your culture is very special. You do give back. I mean, you served on our board. Thank you very much for that. You still serve on a committee of ours. Thank you very much for that. And we know how busy you are. The other folks that I interviewed also do that, and you allow your employees to serve on boards of nonprofits. So that's part of it. Are there other things that you do in the community that we should be aware of? I mean, I know a few because we've helped grant some of those opportunities for
Sure.
Middlesex.
I mean, we have people at all levels involved in lots of different things in the
Right,
community around community health. And we actually track, it's one of the requirements we have as a tax exempt organization is to be able to show and substantiate the benefit that we're providing to the community. So we have a whole department that's dedicated to that. And, you know, we're providing significant millions of dollars of benefit to the community. And I would argue that our mere existence in the community is a benefit. Having a high
oh
quality
yes.
healthcare organization by itself provides benefit to the community. But way above and beyond that, we're involved in many different aspects, trying to particularly being a lot of focus on the underserved, diversity and equity, making sure that um, uh, populations of color have access to care, and people who perhaps have not been able to access the system of care, which can be intimidating and complicated. We have a lot of people who are dedicated to doing that. We have a department that's focused on helping families and getting involved in family issues. We have a new program that just started a couple of years ago around autism. These are not things that you would typically think a hospital would be involved in, but we are. And you know, one of the things that has changed in healthcare that I've seen over the time that I've been involved is, you know, hospitals used to really be focused on solely focused on when people got sick and came to their front
Right,
door. You know, we
right.
kind of saw our responsibility as being, okay, we'll get them well and get them on their way. But once they were outside our door and before they came in our door, we really didn't have anything to do with them. Now our scope is so much broader. We're trying to keep people healthy. We have a huge primary care initiative that's focused on preventive health, um,
Right.
and and helping people to stay, you know, to never need any more
That's the thing. I
services
mean,
from us.
you've got a prescription for prevention, which
Right.
is really wonderful. And you actually have, and when I was reading through all my materials and doing the research, you've got this prescription for healthy eating.
Mhm.
I mean, and you've invested money that for food. I'm going to lose my
Food
train of thought, but
insecurity. Yep.
right, food, but that kind of thing. And what I also love is that you partner with the nonprofits that serve those communities you're trying to reach. And and I also love the fact that you're forward thinking about those future careers with filling the pipeline with potential future employees.
Mhm.
So you've got your Medical Explorer program,
Yes.
which I can't wait to go and see that.
I
And
met with
then,
them actually a couple of weeks ago
oh, did you?
before Thanksgiving. Young kids who were thinking about young adults thinking about careers potentially in healthcare and trying to open their minds to the possibilities. And you know, one of the things that I think attracts most people to healthcare is a desire to do something good and to be,
Right.
change people's lives. And particularly the people who are on the front lines taking care of patients every day, that sort of uh, ability to know that you're changing people's lives and making a real difference is very satisfying. And I see that, and I'm not doing that, but I see
Right.
it. And
Right.
what helps me to get up in the morning every day, and what I truly like about my job, is that I'm supporting that activity and helping. And there's really when I talk to our employees, I tell them there's only two kinds of jobs in our organization. It's the people who are taking care of patients on the front line, and then the rest of us who are supporting that activity.
That's
Um,
well said.
and that's what it's all about. That's why we're here, and that's what we try to do every day. And our mission is really three very simple things. We want to provide the safest care, because nobody comes to hospitals expecting to leave worse off than when they came.
Right. Oh, right.
Although that happens, and it's a huge issue, because hospitals are complex and dangerous places. It can be dangerous if you're a patient. So safety, making sure that patients are getting the highest quality, and making sure they're having a great experience, because often, patients don't know if they're getting the right test. They don't know if their doctors and nurses are doing the right things, but they know if they're being treated with respect and compassion. And that's how they define the quality usually is, if I'm being treated well, then I must be
Uh-huh.
getting good care.
And that
We want
immediately
to
goes,
package that all together.
right, but that immediately goes to trust and
Yes.
trust in you, because they may not know the details and the intricacies of what you're doing on a day-to-day basis, but the very fact that they trust that the people who are treating them are being trained well,
Right.
that you invest in education and the best and the best technology to help them.
Yep.
I'm certainly not going to go back and get my MD, and so I trust you. So you seem to really care about, not you seem, you do really care about giving back to the community and what it's all about and what that means. I mentioned at the beginning, Dave Glidden said he gives back, he does these things for the community because it's the new math from a banker. And as a CPA, you'll understand 1 + 1 really doesn't equal 3, but he thinks it does. And we've had somebody else say, and Jeff say, it's a multiplier effect. So what would you say to other employers who might not yet give back to the community because they're so busy either starting their business or just haven't thought about it? What advice would you give to them about the payback?
Well, I think we all have uh, a responsibility, whether it be from an employer perspective, as an organization,
Right.
and as an individual that lives in the community. I think we have a responsibility to kind of step back and think about the benefit we get from being in a great community like Middlesex.
Oh my gosh, we're
Um,
so lucky.
right. And we can't take that for granted, and we can't just benefit from it and not give back to make sure that that benefit continues to not
Right.
only benefit ourselves, but benefit everyone else that lives in the community.
Right.
We're all connected, whether we believe that or not. And it's very much a team effort. And that's the other thing that, it's a philosophy that I have, that I very much believe in, is, alone we can only accomplish so much. And most of us can't really do a heck of a lot by ourselves, but as a team, we can accomplish great things, and much greater things than we can. The power of teams is immense. And as a community, if we're all helping one another and giving back, those of us that can, I mean, not everyone has the capability to do that. We all have the
We
ability
all
to
have
give our time, effort, things like
right.
that. Uh,
It's not just dollars.
that's
It's
right.
like your skill
True.
sets. I mean, it's like, well, I'm going to summarize, and I hope you'll allow us to use, or you to use this with your employees, because what I'm hearing from you, it's the we before me.
Yes.
It's find out your skill sets and be really good at that and really keep on learning,
Yep.
and then with the team effort that really has the positive ripple effect that just goes way beyond what you would ever consider.
Right. Right.
So
True. So true.
Well, you've given us some good advice. You are so good. I will attest that I am not a good patient, but when I am at Middlesex Health, I try very hard to follow the rules, and I'm going to brag about your folks in radiology, I guess it is, with my MRI. They listened to me. They paid attention to me. They knew my fears going into that thing, and they were just absolutely wonderful. So I hope their supervisor or the powers to be know about how good Alex and Marisol were. And I want to give a shout out to Catherine Reese and Amber Kapoor, because without them, we as a community wouldn't know all the great things that you do, and we wouldn't be able to partner.
Absolutely.
So one last question, two last questions. So what questions should I have asked that I didn't?
Well, perhaps our affiliation with the Mayo Clinic, which
Yes,
is
thank you.
very, very unique. Some people may not be aware of this, but we are the only affiliate of the Mayo Clinic in the entire Northeast. And, the Mayo Clinic has created what they refer to as the Mayo Clinic Care Network, which is a network of high-performing organizations, healthcare organizations throughout the world. I think they're up to like 80 or 90, maybe even 100. And they're hand-picking organizations that they want to work with to do a few things. One, they obviously want their brand to be out there. So they want a venue to be able to, a network to be able to expose their brand to the world. But more importantly, they want to work with high-performing healthcare organizations who are like-minded to advance healthcare. And so there's a whole host of things that we're doing with them that I think have elevated the level of care that we're able to provide to our community. I think the most tangible is probably for patients is what we call e-consults. So any patient that sees any of our doctors could ask for a second opinion from a Mayo Clinic physician. And, they have 6,000 super specialists and cover pretty much any specialty that you can think of. And so any patient that is having an issue and wants whatever our doctors might come up with to be reviewed by a Mayo Clinic doctor, we can make that happen. It also allows any of our physicians, we have 600 or so physicians on our medical staff, and physicians often encounter difficult cases, and they will often collaborate with their peers. This gives our doctors 6,000 more doctors to bounce things off on.
It's just great. It's just another reason to just be, Middlesex Health is another reason to be so thankful that we live in Middlesex County, we work in Middlesex County, and we play in Middlesex County, and we stay healthy in Middlesex County. So thank you for that. And my last question is, so what are you looking forward to in the next month or so? 2 months?
Well, I think selfishly, I had a hip replacement about
Selfishly, you needed to.
So I'm looking forward to walking well and being able to play golf when the snow clears. So that's what I'm focused on right now. In addition to doing my job at the same time,
I know.
Going to physical therapy and doing my day job is becoming difficult.
No. And I'm going to give a shout out to your physical therapist, particularly Liz Jones in Westbrook. And I'm going to start physical therapy down there with Megan. So they are the best in the whole wide world. So thank you for that. Thank you for your dedication to the community. And thanks for your words of wisdom. We really appreciate your time, Vin.
Thanks for giving me the opportunity to have this conversation. I appreciate it.
All right. Thank you for joining us for this week's episode of Meaningful Mondays. At the Community Foundation of Middlesex County, we know that philanthropy matters and philanthropy works. Together, we support the arts, education, human services, animal welfare, the environment, heritage enhancements, and so much more by providing services, programs, and grants to our local nonprofits. We invite you to learn more and share your passion with us. Visit us at middlesexcountycf.org or contact us at 860-347-0025. Together we can make great things happen.